Hey, everybody. Good to see everyone. Thanks for joining us today to gather and share and, talk about maybe some changes that are happening. And so I'm going to give just an update, make sure we're all on the same page, just to give me kind of a gauge of the group. How many of you know that cases are going up right now in the state and in our local area? Thumbs up, yes. Okay. So we've been, I met with the staff pandemic committee yesterday, and so there's about 30 on the committee, about 23 or 4 joined that conversation, and so we talked about, kind of what's happening in the state, what's happening locally. As you all may know, I think there's about 140,000 deaths now in the United States from COVID, and we have about 4,400 plus in Indiana. And so one of the percentages that we've been looking at all along is the unique numbers. So I've just stuck with that. So we have a level of consistency. So I'm going to just share my screen with you just a minute so you can see if you haven't seen it already. So can you see that okay? Okay. So this is just this is the dashboard at indiana.gov. And so, this is the number, get to my right screen, that we have been comparing to. This has gone from like 3% to 6%, probably stayed right at 6% for a while. It's now at 18.6%, which means that my understanding is that's the number of unique individuals over total individuals that are tested on a 7-day average. So, I think it's a pretty good, there are lots of variables to all of this, but I think it's a pretty good gauge, especially when we look at the same number over time. When we look down at the counties, so yesterday, Floyd County, I think, was right at 17%. For the 7-day unique individuals, we're at 16.6. Harrison County is at 18.1, and Clark County is at 17.2. And so those are kind of the numbers that we're looking at. I think bigger than all the numbers is just what's happening in our community. And so you may have seen this article in the News and Tribune yesterday. COVID-19 continues to climb in Southern Indiana. From our point of view, we've received 12+ emails over the last 7 days of families that either have someone positive in their household or have somebody that's been a close contact in their household. And so, it starts to make all of the pandemic plans that we've created very real very quickly. And so, as we started looking at the plans that we had in place and then seeing how, we still have only had 1 case and we've had no spread of infection on campus. So we are very thankful for all of that. We feel very fortunate to have the partnerships. I know, speaking to colleagues of other charter schools and other schools in general, they have not been that lucky that kids have come on campus that were positive, and families have been like, they're wearing a mask. And so we have a very educated, very committed, very partnership community. So we are very thankful for that. But we also know that like the numbers are increasing exponentially. And, my role is to keep the children safe that are on the campus, the staff safe on the campus, reduce the spread, be a member of the community that doesn't increase cases where our hospitals are in jeopardy. I again could communicate weekly, if not more, with our local health department commissioner, Dr. Tom Harris, and kind of get a gauge on what's happening locally as well. The last 7 days, so 2 weeks ago, the percentage in Floyd County was 12%. So they do their matrix a little bit differently than the state does. And so they'll come out with their new number, their local matrix number tomorrow. And so, that could be similar. Sometimes it's higher than the state matrix, so it's just hard to really to tell. You're free to go online and read this article. I really just wanted to let you know that it's there. And I wanted to talk to you about, so I'm pulling up now the CM pandemic plan. So you can get to this on our website at shinyminds.com and go to current families, and then you'll see the pandemic plan. And so 2 big things that we want to impress today. One is that if there is a COVID positive in a household, which has happened already, that, the role of that.
Hey, Barbara,
COVID,
you might zoom that in just a bit. It's a little hard to read for us.
Okay. So try not to pay attention to that yet. Let me just talk through this a minute, give you a scenario. So if there's a COVID positive person in the household, what the CDC guidelines say is that person should isolate from everybody else. Well, most certainly, and often what we are finding is that that's a parent, and the parent cannot isolate from their children. So there is, and so if they are isolated or if they go somewhere else, then this doesn't, meaning that if the children stay, if they have a blended family and stay with dad and mom's the one that is positive, then, none of this, what I'm about to say, applies to that. But this is when families live together in the same household and there is somebody positive in the household. Then once that person that is positive, and, there are so many ways that people are figuring out how long that person should stay home. I've heard doctors say 10 days from whatever the point of contact is. I've heard them say 10 days from the symptoms. I've heard them say 10 days from the test. I've heard them say 10 days from the results of the test. So, etc. We say 14 days. We say 14 days from whenever your symptoms started or whenever your close contact was. And that just kind of encompasses all of that. So, but we trust in you that if you're working with your doctor or with the testing site and they give you a date of return that's 10 days from something, that makes sense, then we trust you with that. And so let's say that on November 1st, you were close, not even close contact. We're not talking about contacts, we're talking about positives. Let's say on November 1st, you got your test results back and you were positive. Then on November 10th or 11th, you should be clear at that point from the CDC guidelines. So what does that mean for the children? Can the children then come back on November 11th? Well, what the CDC tells us is that the children can get the virus at any point during that 10-day period. So on November 10th, they could contract the virus from you, and now they have it in them. And so now they're building load, and they, so some families have been like, well, I was positive on the 1st, and then I had my child tested on the 3rd, and my quarantine's up on the 10th, so I'm going to have them return on the 11th, and they were negative on the 3rd. Well, if your child tested on the 3rd, they did not have, almost certainly, enough virus load to be able to say if they're for sure that they're negative. And so really what the guidelines, some guidelines and some organizations are, they do test at day 5 and then again at day 10. And so what we have said, what we've put in this document is if someone positive in your household and you on the 10th day, so however that's determined from you, if it's the 10th day from when you think that you were positive or started getting symptoms, then you test then. And if you are negative, if the child tests at day 10, so we're talking about the children that come on campus, so whoever comes onto campus, if they're in a household with somebody positive, then they would test on day 10. And if they are negative on day 10, then they can return after the quarantine. Okay, so if the quarantine's up on the 11th and they tested on, the 9th or 10th, and then they got the results back on the 12th and they were negative, then they could come back to school on the 13th. And so we feel like that is the best way to make sure that we're not having kids come on campus when we have a growing number of households that are having positive cases. So I'm going to pause there a minute. This is written in the pandemic plan, but I'm going to pause there and see what questions or clarifications. I'm going to turn my air up a little bit in this room. So.
I'm clicking the chat on now for everybody, so you should be able to get in there.
So, Melissa, help me because I'm looking at this again. I don't see where it says about positive. Is that added somewhere else? What I just explained?
Is it down farther? Because that's a close contact. Is it?
Yeah, because then we go into sanitizing.
Okay.
I'll let her look at that a second, but. Okay, no questions. I'm going to keep moving. I think, who's doing the questions, Melissa? Oh, Melanie and
I am.
Okay, Kelly. All right, questions, ladies?
Yeah, no questions right now.
All right. And Melissa, you're still looking.
I was talking and I was muted. You guys didn't hear me. Yeah.
No.
I answered that question. Sorry.
Oh,
Yes, Kelly.
I thought you were just in deep thought. We were going to give you lots of time to think. Go ahead. What did you say? What did your mask hear you say?
I just said it was Kelly and Melanie, and I was saying this is repeated down at the bottom under the on-campus commitments for families about close contact. So if you want to scroll down to the family commitments, all the updates are there regarding like time out of school and all that.
Okay, so the positive case, it wouldn't be here. You're saying it's down at the bottom.
Correct. Yeah, keep going on the part about learner commitments. Yeah, here you go.
Okay.
Can it be also added in at the part that we were just looking at? Because the part that we were just looking at says the new information with today's date. And so if somebody reads that, then they won't know to look further for more new information.
Yeah, maybe I need to bookmark it there too, like I did at the very top of the plan. I'll do that. Good idea. Really, that was there because we had like 2 brief statements under that on-campus, off-campus about quarantine guidelines and symptom guidelines, and they just weren't enough anymore. So I beefed them up and then added it down here. So I think your point about a bookmark, though, is a good idea.
So what we were just talking about is if somebody's positive, and I'm probably made that more confusing than it is. I did the 10-day, which is really part of the next conversation. But if somebody is positive in the household, then any of the children that are coming on campus would quarantine for 14 full days from the positive. And I'm sorry.
Yeah.
So
what it is for the original so there's a person that tested positive that's actually in your household from whom you cannot isolate or separate. So this isn't the same as like someone at your work, you were around them one day and then left. This is someone who also lives in your house, is positive. They have a quarantine and isolation of 10 to 14 days. We're using, if we do it, we're using 14 days, but it could be 10, which was the part you were talking about. From the end of their quarantine, the child has to isolate another 14 days because they could have been exposed up to the full end of the positive person's quarantine, and they cannot separate themselves from that person.
So it could be 4 weeks, right? So that's the point that people need to understand. I'm sorry, I keep not reading the yellow part. My eyes just do that to me. Darn it. Okay, so now let's talk about close contact. So if the learner is considered a close contact, they need to quarantine for at least 14 days before coming back on contact. And then please communicate with studio teachers. You know, what you see throughout this whole conversation is please communicate, err on caution, you know, like we are trying to not overwhelm and close down studios or levels or the school. That is our goal. And so just like we're always also trying not to overwhelm our healthcare facilities. So, you know, please err on caution. And so then if a learner or a member of the household is a close contact, the on-campus learner should stay home for that same period of time and maybe more. It probably is going to be more, but it is so situational. You know, so I talked to a family today. They had a close contact on this date. They had a test on this date. But again, it goes back to if I'm a close contact and I get tested the day after my close contact, it is not a valid test because I have not given time for the load to build up. A month ago, doctors' offices were saying, wait 5 to 7 days. That's really keeps expanding. So we're suggesting you wait 10 days after the close contact, and then have the child and the learner tested. And we may ask them to stay later. If you don't want to get tested or you don't want to share the test results, I mean, honestly, there are families that are choosing not to test right now because they feel like going to the testing locations increases their chance, especially if they have to go inside, of getting COVID. So they'd rather just stay out for the whole 14 days, which is fine. But that still means that your child then will probably be asked to quarantine another 2 weeks after your 2 weeks. So that's why we say, please communicate with the studios so that we can tell you, you know, what that looks like. And we'll try to look at the numbers and think about, you know, when the quarantine date was. And so like the family I was talking to this morning, they have the option of either testing again, so if they had tested prior to the 10 days, or they could keep their kiddos out until the 2 weeks after their 2 weeks. Okay, I'm going to pause there and see if there are questions. Clarifying, say something. Let me know what you're thinking, if that makes sense or something. Thank you, Valerie.
There's someone saying, I like the update.
Yeah.
Here's
Go ahead, Melanie.
there's someone saying, I had figured you were going to move everyone to all online. Sounds like that is not the case.
So that's the next part of the conversation. What's our plan with 18% positivity? And, you know, we could tell that our family members are in contact with what's happening. So what we are going to start, and this will have a couple of phases. So starting on November 16th, which is Monday, learners the 6 to 9 program and up will only come on campus if they are enrolled in the FSP program, family support. So starting on Monday, November 16th, for 6 to 9 studios, 9 to 12, 12 to 14, 14 to 18, only people that will be on campus are those enrolled in the family support program. So if your child is hybrid, they will not be coming on campus between Monday and through December, and then we'll see what we do in January. And if you're saying, well, they've been hybrid, but we just started hybrid, and can I move to FSP? There's a form, right? It's been on all the Cupola notes. So you can go in the archives, the Cupola notes, which are linked to all of the studio level websites, and you can request that. There aren't many spaces. You know, most of the studios are full with all on campus, but you can request it, and we'll let you know if that's important to you. If you feel like your enrollment has changed, and we have some families that are enrolled in FSP, Family Support Program, that have not been on campus yet this year because they've been kind of holding. And so if you don't feel like that's going to change and you want to now move back to hybrid, please fill out the form so we can make spaces for other families. Obviously, the reason we're keeping, and the staff pandemic committee talked a long time about should we be moving everyone off campus right now. And we really felt like that was more of a jump that we needed to make right this minute because we're all doing really well with it. And again, we've only had the one case on campus, so it feels like that jump is too high. But we know for some families that they might make decisions more than that, like they might decide to not bring their family support program enrollment on campus right now. And if you want to make that a permanent change, fill out the form, and that makes a spot for somebody else that might need it. So for early ed programs starting on November 30th, so a week from Monday, I'm sorry, 2 weeks from Monday, so it's after November break, they will be moving to only FSP on campus. So all hybrid learners will be off campus starting on November 30th for early ed families, 3 to 6 year olds. This will continue through December break, and then we will make a decision about January when we know more. So we might have another video call right before we go off on winter break. We'll see where things are at that point. Questions, comments, thoughts?
There's another question. Just so I understand, if we have children in hybrid program currently, they are moving to full-time e-learning starting Monday. And sorry, can you clarify the dates?
So if you have a child in the 6 to up program, 6 to 9 studio or up, all hybrid learners will be going off campus starting on Monday, November 16th. Early ed families will stay, hybrid learners can stay on campus next week. The early ed staff really wanted another week with those kiddos to start to put plans in place for them going off campus. So on Monday next week, all hybrid kids can still come to early ed, 3 to 6 year olds. But starting the Monday after November break, only family support program will be in the main building. Nursery will stay as is. The nursery plan has not changed, and so it will stay the same as it is now. Other questions, thoughts, clarifications?
Hi, this is Jessica. Can you hear me?
Yeah.
Oh, thank you. I guess I was in mute. So for the support program, so we get I'm in the support program and I'm so grateful for it. What are we to be prepared? So we're still staying. What are we looking for the progress of cases, like, so we can get prepared?
Mm-hmm. I wish I had a nice paragraph to share with you about that. Such an unpredictable year. I mean, honestly, my first layer of filter to answer that question is with the staff. Number one, the staff feeling confident and secure in what we're doing. And number two, having enough staff to be in the building. Like what you all don't see, if you whip behind the curtain, what you would see is that we're constantly moving people around to try to cover the spots because this person's out on quarantine. As you can see, I'm home right now. I've been on an airplane to Oregon. I don't have to quarantine, but I am quarantining so I can get a test this week because I was at a funeral and I was on packed flights for 6 hours, so anyway, most of our staff aren't quarantined for that reason. They're quarantined because their spouse is COVID positive or because their grandmother is, which was around the grandchildren. So, those are the two first things, honestly, that we look at is if we could do this well on campus and if the staff feels safe on campus. So like I shared in the conversation yesterday with the staff, there was a little bit of conversation about should we consider going off campus now? And the majority, said it doesn't feel like it's the right time. We know how important this is for the families, that need to be on campus right now. So that's one layer. I think the next layer of that is I anticipate, I hope, honestly, that Holcomb, our governor, will adjust the plans for the state tomorrow at his news conference. So the local health commissioners here in Clark and Floyd County both feel like we should not be in stage 5, and that is a problem. And so now what that will move to, I do not know. We all know that there's new president-elect. Nobody knows if anything will change because of that. And so, barring any of those kind of communication, the health commissioner and Floyd County has said at this point they are looking at making some changes locally. And so he's not anticipating changes in school at this moment as far as any directives from the local health commissioner. But we know that could be a possibility in the future. So I think those are the two things. I'm not looking at any set percentage. If we had those percentages and we didn't have all of the communication from families being either close contacts or positives, we may have kept the the hybrid kids on campus a little bit longer. But with both those things together, it felt like it's the right time to move down a notch, and then, good news about the virus, maybe, we're hearing good news about that. The reports are anywhere from spring to next fall when they'll be available to the general public. Kids are not on that list, so there will not be children getting vaccines with this first dose of vaccines. And there it needs to be 2 vaccines. Anyway, I'm sure you've all done your research on that and know that part. So, we're just taking our step one step at a time to create the best education for kids on and off campus.
Thank you.
Yeah. What else? Anything else?
It has felt like there's not a lot of direction from the state. I know, like on Facebook, I have a lot of friends who send their kids to Jeffersonville High School, and Jeffersonville High School just had to move all their kids to e-learning, and parents are freaking out. And somebody was saying, it might help to have more state guidance to support the schools. And in the absence of that, schools are just having to figure things out themselves. And I think you guys have done a really good job trying to figure things out for yourself without that kind of real serious direction.
Mm-hmm. Yes, we are. Honestly, I say we are doing the impossible. Spending a week and a half in Oregon, it is very different there. And, everything is created from a holistic point of view. And in Illinois, where my daughter lives, they're all in regions. So the regions are told what to do based on the scientists, the doctors. And in Indiana, we're given guidelines that sometimes flip-flop from one week to the next, and we're told, your choice. You decide what you think you should do. So it is very, very difficult. And but I think we've committed to stay super informed, the best we can, and have, and I talked to many of the superintendents as well. It is, all the schools are really doing the impossible right now without much knowledge. And, I don't know what we would do if we had 5,000 children and teens, honestly. And I can't even imagine those larger schools, how they're doing this well, frankly. But we're fortunate, and we're also fortunate that we have a co-teacher model. And I know that's been a complaint for many other schools and families, is that, kids are there, but they never have their own teacher. Things are just switched around all the time. So which is also why, we're also doing the possible where the teachers are both teaching kids on campus and off campus, because the staff wanted so much to keep the kids that they've been connected to for some 1 to 3 years. So, it is much harder to do that and have 1 foot in, 1 foot out than it is just to have the ones that you're supporting. So, yeah, thank you. Yeah.
There's another comment. It says, I agree with Valerie. We are in such good hands with outstanding CM community and leadership. You are doing the extra work and we appreciate it. Thank you.
Great. Thank you.
There's another question. How would you recommend that we talk to our kids about this change?
Yeah, it's a good question. I think it would depend on the age. What's the age? Can someone put that down with the question?
6 and 9.
Yeah. So I would assume at that age you've told them about COVID-19, and so I think the article that went in the News and Tribune, which is a local story, I think would be good to read to them as a family, and then share what your values are about that, and what the rationale was for the school. And that we've got all these ways that we can still connect with your friends and your teachers, and so we'll get to try something new if they were on campus. So that's what I would do. I mean, one thing that we will do this year, if not anything else, is we will build resiliency with our young people and our adults, because we are constantly leaning into something new. And I think the number one thing I want to make sure that we all remember is just communicate. We have such a wealth of knowledge with our teachers and staff. And if something's not going well as you transition off campus, if that's the case, or you've been off campus and something's not going well, or something's not going well on campus, like we have ideas and thoughts and changes, and I'm coaching with coworkers every day about that. So please don't hesitate, through that transition to reach out, because every child is unique. Every family situation is unique. And we have lots of experiences with doing things in very unique ways. So let us try, we'd be happy to help. Anything else? Well, thank you all so much for coming on today. We'll get this video up for the rest of our families. Please feel free to email me directly, or give us a call, or any of the teachers or support staff. We are here and grateful for your partnership. Have a great day. Bye.